Ano dito Panginoon? Bakit ba? Mula sa ba? Ay, kamula din mo. Ano, second touch ka? Okay na yun. Okay na daw. Okay. Good morning. Good morning.
Morning, Doc. Morning, Doc.
Okay.
Morning po, Doc.
We have already taken up last time the history, how to take the history of the patient in relation to their illnesses. Now, I will give you on how to interview or how to take the history. What you should do in order that you can take the history of a patient. No? There is history, as I've said, to the medical, to the surgical, but in psychiatry, I've already shown you that it's like a life story. In surgery and medical, the chief complaint of the patient is only what you will take the history. For example, the patient is coughing, so you will start what happened to the patient before the patient was coughing until the patient coughed. In this aspect, you are taking the life story until the patient has had behavioral changes, and has psychiatric problem. So there are many considerations, So role of diagnosis in psychiatry. So as I've said, psychiatry is different from other fields of medicine. It's really very different because we are taking here the life story of the patient. If the patient has had a medical problem, it would be included here. If the patient has a surgical problem, we include it here. So another consideration is the stigma attached to being a psychiatric patient. So meaning to say, when you are dealing with a patient, to take the history of the patient, you have to consider this. You have to consider this, the role of diagnosis, because it's different from other fields of medicine, the stigma to the patient and the relatives, and then the difficulties in communicating. What do you use before? What is stigma attached to being a psychiatric patient? So sometimes the patient coming to you will not be, he just can't sleep. But actually, there are already behavioral changes. They are ashamed to express, to tell you that this patient is having a psychiatric illness. What they will tell you usually is acceptable to the society. Like, as I've said, they cannot sleep, but actually, they will already have symptoms of behavioral changes. Like, for example, they cannot sleep, they have palpitation, they have restlessness, or they have some behavioral changes which before the patient had. But what the family will tell you, or the patient is, ay di rila nangaturog, no? That is the only thing usually that they will reveal. But if you dig deeper to that, there are other symptoms that you will know. So that is stigma attached because they cannot accept. No? Then difficulties in communicating. This is an example if the patient is the one coming to you, especially when the patient is alone. No? For a consultation, as I've said, they will only tell also, Doc, di nga yan lak na naturog. But what you know, what she's telling, or what he's telling you is all delusionals. All delusion, meaning to say, what he's telling you is out of what he's thinking, false thinking. He will make stories that is you thought it is true because you have difficulties in communicating. Because what they thought sometimes, their hallucinations, what they are hearing is the one that they will be telling you. But actually, that is delusions, hallucinations. So that is another consideration when you interview a patient, no? Difficulties in communicating, not necessarily stuttering, but difficulties in communicating in terms of if they're telling you the truth because they are having only delusions and hallucinations. No? What they're expressing is their hallucinations and delusions. So you have to bear in mind, or you have to observe the patient if what they're telling to you is really the truth. So if they're having some accompanying relative, you have to confirm that to the relative. Yeah, is it the truth? Amin na niya ginyayakan. Umaga. Sige daw, pag-istorya daw. Only to find out that what the patient is telling you is not the truth. But actually, he is not telling lies, no? That is only his delusion. Because he thought that what he's telling you is really the one that what he feels. But it's not the truth, as I've said. So better confirm it to the relative. Another is interpersonal factors. So you will experience that when you already in the clinic. No? What is transference? So transference is what the patient feels to you. Maybe the patient look at you as a sister, as a mother, or as a boyfriend or as a girlfriend, that is transference. Then you have countertransference. Countertransference is when what the patient is telling you is also how you feel. So how can you advise or how can you combat what the patient tells you, because you are also sharing the same sentiments with the patient. You are having counter-transference. For example, the patient tells you that, I do not like my mother. She's not good to me. So you as a doctor or as a clinician feels the same. So, and you will, especially when you tell, ay parehas kita, I do not also like my mother. So do not do that when you interview the patient. It has a very big factors, no? Factors. So you have to listen to the patient, no? You have to also evaluate yourself. That's why it is, we can say, difficult to become a psychiatrist, because sometimes you are sharing the same sentiments from the patients, no? So you will have sympathy, empathy. So how can you counsel or how can you advise the patient if you have the same feelings? And then you have also, ay, patient, wapo, paranak boyfriend. So you are having counter-transference, no? Sabi pa ng ano ko noon, ng my teacher, my mentor at where I graduated. But later, of course, he will be your colleague. He said to me, Doktora, dili ka na-cross sa patient na mga gwapo, na mga, so that's counter-transference, no? So bear in mind that what you are, whom you are talking is having some problem, especially psychological, no? Problem. So you do not have to share your experiences to them. Maybe you can introduce yourself, but sometimes it's very, you have to be careful, because instead of you who are asking, they are the one asking you. No? So the patient will ask, you will ask them, where do you live? So the patient will also ask you, how about you, Doctora? Where do you live? So until such time that one day the patient is in your house visiting you. No? So you do not have to put on your feelings to your patient. No? Be objective, what I mean. No? Be objective. Because these patients are having transference. They look at you as sympathizer, no? Especially if they know that they sympathizes you sympathizes them very much, especially the males. For example, they had a breakup with their girlfriend, so nagkaka-transference sa imo, so nakrush siya imo. So until sa time ato nag-ibalay, so you have to be very careful, no? So ikaw liwat, wow, my patient is so handsome, so it's like my boyfriend. So you cannot anymore also give advice to your patient, because you had you rationalize, maybe this patient is like my boyfriend, so be careful. So these are the considerations when you interview a patient, no? So of course you also have to have what you call that, your patience, because it takes time the patient to answer. So you should have patience, no? So these are the considerations before you interview the patient, before you take the history. No? I've already tell you the outline of the history. So there are three main components of the interview. You have the beginning of the interview, you have the interview itself, then the closing of the interview. No? So what is in the beginning of the interview? What do you do? Of course, you have to introduce yourself. Oh, why? because it's very important to introduce yourself, because this patient, especially this schizophrenic patient, has no trust. So you have then introduce to them that I am, for example, you are a medical student, we are here to help you. That's why we ask you what happened. Do not, as I've said, put words into their mouth. Like, for example, nakanika, ano yung problema? The patient will tell you, kay ano, ikaw na may problema, wala ko problema, no? So you have to be very careful of the choice of words that you will impart to your patient. But it's very important to introduce yourself. So I am the medical students and we are here to help you. That's why we're asking you, so we can give it to your doctors, so that it will be very, you will not have a long time, and having the doctors will be, you will be entertained immediately. That's why we are asking you. We will present to you to the doctor, to your doctor, because sometimes if you will not interview, they will not talk to you, no? Especially the depressed patient, before the patient was already admitted, no? Of course, you are new in that department. You will visit the patient, and then you will ask them, anong problema na Doroy? Pag maya kang kaano din problema. So do not put words, no? Until this time that this patient was already irated. So what happened? The medical student was he throw his pillow to the medical student, or sometimes they will harm the medical student. So when you interview your patient, see to it that you are not so close to your patient, no? There must be something at the middle that is heavy, so that the patient could not easily box you, because even though they are taking the medicine, it is very important that you should be careful, because they are unpredictable. You know, they are as if normal, telling you, you're telling stories, sharing its conversation, but you do not know what's in their mind. So you have to be very careful at the beginning of the interview. Then the interview itself. Of course, the beginning, you introduce yourself. We are here in the clinic, no? So how are you? You will ask the patient. So who is your accompanying relative? What is your name? So you have to ask also the name, because sometimes they do not want their names. Like for example, at the beginning of the interview, I asked the patient before. I called the patient, Ostina. She doesn't like her name. So what happened? She doesn't like her name, so she said, "Who are you? Are you a doctor?" They get mad, no? So you have to ask the patient, even though if it's in the chart, their names appear there, but you have to ask what they would want, what you want them to call them, no? What they want to be called, because sometimes they do not like their names. No? So where you came from? So you have to, if the patient is very clean, you have of course to appreciate how they dress. No? So that's the beginning of the interview. Then the interview itself. That is the beginning of the interview, no? Establish rapport. As I've said, put the patient at ease, introduce, name, relatives, already taking the or medical student. The beginning. How do you establish rapport? By the way, as I've said, when you start with the patient, in front of the patient, how to establish rapport, you have to put the patient at ease. Do not be anxious, because if you are anxious in front of your patient, you are communicating your anxiety to the patient. So establishing rapport is you have to appreciate how the patient dressed, is clean, how are you? That is establishing rapport. No? Tagading ka mo, tagading ka, hinag imuupod. No? But at first, they are really sometimes, because they do not have yet trust, they will not answer you until such time that they will stand up and leave you. No? So be ready for that. No? So privacy means sometimes the patient cannot tell you their problem, how they feel when there are relatives. So you can say the relatives, maybe you can just let the patient stay for a while, and I will just talk later. I will just call you later. No? So questions. So in there, after the patient will introduce to you or you introduce to them, you may also ask questions. Do you have any question with regards of our introduction, how we introduce, no? Behavior and feelings of patient. So see to it that the patient is not so irritated, because maybe if the patient is violent, they will not answer. If the patient is depressed, they will not talk. So do not force the patient. By that, in your mental status examination, even if the patient will not talk, you can write at the mental status examination of what you want, the exams that you want to get, no? So you have to be very careful to have a gut feeling of the patient's feelings, no? If the patient is violent, very violent, do not be interviewing the patient, because they will get more violence, no? You will get more violence. If the patient is depressed and you want them to talk, do not force the patient to talk. You might be boxed, no? So you ask the patient as you go along with the conversation, you have to, every now and then, evaluate the patient feelings and their behavior. So you have to bear in mind, at the first beginning of the interview, you already have an evaluation of the patient as a whole when they arrive, when you see the patient the first time, especially the first time. So in an interview proper, you have to consider the content of an interview, the process of the interview, and there are specific techniques. No, we have this open-ended, the closed-ended question. No, so we have this content of an interview. Content of an interview is when you ask the patient will answer you. That is the content. The words that the patient will really say, no? The words that he will impart or she will impart to you. That is the content of an interview. The process of the interview is your observation to the patient. Maybe the patient is restless. Maybe the patient doesn't want to answer you. Maybe the patient is mad at you. That is the process of the interview. The content, what really the patient tells you. The process is how the patient behaves, how you observe the patient. That is the process of interview. Then you have the so-called specific techniques. That is the open-ended question and the closed-ended question. What is an open-ended question? An open-ended question is, for example, how are you? No? Closed-ended question is, what did you eat this morning? That is the closed-ended question. So when you want to talk the patient for a more longer conversation, but usually when the patient comes to you the first time, it is very important that you take the duration of your interview, for example, 30 minutes, because they don't have patience to talk, especially that you are new to them. They do not have trust you. But anyway, I'm just telling you how to open up, how to start an interview that is open-ended. How are you? So what happened? Closed-ended. What did you eat this morning? Who's your mother? So one question, one answer. That is closed-ended question. Then you already an interview proper. So there are many what you call that factors there or kinds of of techniques, no? For example, reflection. So reflection is to repeat to a patient what you said. So when the patient will tell you, Doctora, I want to go on suicide. So as a reflection, you will ask them, may I hear again? You want to go on suicide? No? How would you do it? How would you do it? No? What will you do to go on suicide? No? So you have to repeat, no, to a patient words. That is reflection. Then silence. Silence is, you can see especially when the patient is crying. Do not stop the patient from crying. Why? Because it is one way of expressing. No? Diba? We want to cry. We do not want to talk sometimes. So let them cry. So you may give a tissue to the patient. Okay, you may cry. Tell the patient. No? Because that is one way of expressing the feelings of the patient. Do not stop the patient from crying if they cry. That is silence. No? They will not answer you. So you will observe that if the patient will not answer you, so he maybe have sadness, no? So that is silence already. Then positive reinforcement. No? What is positive reinforcement? What is positive reinforcement? Positive reinforcement is encourage patient to tell anything. No? That is positive reinforcement. When you encourage patient to tell anything, you will just tell the patient, oh, how are you? So the patient will tell, Doc, this is how I feel, I'm fine. So where you came from? So she will tell you. So what happened? Who brought you, who bring you here? No. So you try to encourage patient to tell you. So in that way, that's positive reinforcement. Sometimes patient does not, as I've told you, does not want to continue talking, especially when the relative or the accompanying relative is around. So if you encourage patient and they will not tell, so you let the caretaker go out and you will tell just, ma'am, please, pwede lang kami mag-istorya, can we talk? So positive reinforcement is encouraging patient to tell. Maybe at first, do not tell the patient, pwede ka magsuot hapon ka tanan. No, do not do that. No, just what happened? As if you are talking to your friends. No, of course, you bear in mind that even you, the first time you see a person, you will not tell everything. No, so it's like the patient. And this patient are psychiatric patients, are having stigmas. No? Patients are having delusions and hallucinations. So you cannot expect what you want to take from them. So that is positive reinforcement. Then explanation. There are many in your books. There are many explanation. What is explanation? Of course, you have to tell your patient why do you have to give this medication? What is this for? So you have to explain, kano na pagkana kay to doktora? So you have to explain your patient very well. Diba some of you go to the doctor, yet you do not know. When you go home, ang ambot amin na ginahataga ako niya para medisina, basta sa doktora, tumumag. No. Even if you are not in psychiatry, no? If you become a doctor, you have to explain your patient why you give the particular medication, why you ask that kind of question. So explanation is very, very important so that they will understand. And even you will understand why you were asked, why you were given the kind of medication that you are taking already. Then another is self-revelation. It's useful. But as I've said, do not tell your address. Do not tell I'm single. Do not tell that I like you, no? Because sometimes patients are sexually preoccupied, or sometimes they broke with their boyfriend or girlfriend. So if you keep on revealing and they had a crush on you, so they will be following you everywhere you go, no? So be careful of what you tell. It's important just to introduce yourself. No, I'm like this. No? When I was at the psychiatry department before at ERMC, when I was the head before the psychiatry department, sometimes all of us are already married. No, I'll tell them, Doktora, may nanim asawa. Doktora, hindi masawa. No? Masawa po sa mga general. No? Because the following day that you will tell them where you live, where your residence, they're there already. No? Sometimes they will follow you to the mall. No? They will just stand by outside, and when you walk, and when you just commute, they will follow everywhere. No? So it's very difficult how to separate this parent and this patient. No? So be careful of what you are telling, what you want to reveal to them, no? Not patakala pag pinan-reveal if you want to reveal to them yourself, no? Then confrontation. Confrontation, suicidal, denying. So some confrontation, you try to be assertive to the patient. Diretsuhan, no? When you confront your patient, the patient will, the depressed patient will not tell you that, most of them will not tell you that they want to commit suicide. So pag depressed patient, so directly ask the patient, gusto magpakamatay? You want to have a suicidal attempt? So what you will do? Ano't imo bubuhaton pagpakamatay? So that you will already warn the patient's family, or you warn that this patient should not be alone in the room. So you have, so that everything will be kept, the sharp objects, the, what you call that, any ties, no? You have to keep this. Any knife, no? Any medicines that are in bottles, because they will really do it, no? So confront immediately. No? You try to be assertive. Clarification from the word clarify. Of course, you have to clarify. Is it okay? It is the truth that you already had this had suicidal attempt. Clarify that. So what are the factors influencing both content and the process of the interview? As I've said, the content is what the patient said. The process is what you observe the patient, no, and what the patient is doing, no. For example, yeah, she's telling you that she's sad, and you observe that she doesn't want to talk anymore. She feels she had already some sweating, no, she's sweating, meaning to say she is anxious already. So that's the process of the interview. So these are the factors: the patient's personality and character style. So there are patients. Of course, you have individual differences. There are patients that are talkative. There are patients that are silent type. And nevertheless, even the patient is very talkative, maybe the patient is having manic phase. So you try also to evaluate the patient. If the patient is introvert or extrovert or does not want to talk, and the style that she wants. Maybe she is a reserved type. No? She is not so open to you. So try. Anyway, it's the first time. You have to follow up. It's very important to have follow up, because at the first, as I've said, the patient does not have trust yet. So you have to be very careful of their personality and their character style. They may not want your style. You might be a bold interviewer, but they are a reserved type of patient. Then various clinical situations. Of course, whether you interviewed at the patient at the emergency room, whether in your clinic, whether there are many factors, there are many people around, so sometimes they feel ashamed. No? So clinical situation where you examine the patient, the place. No? Then technical factors. What are the technical factors? Sometimes technical factors, there are technical factors. Example, there are telephone, like ringing of the telephone. So sometimes they are very they can be easily distractible. So they will go, especially if they are what you call that, very disturbed. They will just stand up and answer the telephone. No? So that is the technical factors. So when you interview the patient, it is very important that telephone is not there. So you can see the clinic of the psychiatrist. There are no flower vases. There are no many things in the table. Nothing, because they can throw these things to you. No? That is technical factors, and they easily are distorted. Then the timing of the interview. Timing of the interview means maybe the patient that time when she comes to you, she is depressed, or maybe when the time when she comes to you, she is manic. So it depends. No, so you have to follow up this patient. That is the timing of the interview. Then the interviewer style, orientation, and experience. As I've said, also it depends on how whether you are an assertive, whether you are a reserved type of a doctor. So it depends. So maybe the patient will just would have try to observe you, the kind of interview. Sometimes they do not want your approach. That is the interviewer style. The approach that you have, no? And the orientation, how you were oriented as a doctor, it also applies to you can apply that to the patient. Where you had your clerkship, no? When you were studying, no? You were having a residency training when you're already a doctor, no? And your experiences of course, experiences that is already, you have a counter transference. So these are the factors. You have to consider that. So in the ending of the interview, it's very important. Important that, of course, you have to thank the patient. Thank you for answering my question. I am expecting that if I will give you another appointment, we will see this again. I will see you again. That is the ending of the interview. You have to thank the patient. No, it's very important. Then appointment. That's why appointment is very important when he or she should come back. Then referral, of course, you will tell the patient that if the patient is having another comorbidity, for example, the patient is having a thyroid problem, you have to tell the patient that would it be okay if I refer to you to other doctors because of your problem, your other symptoms. You have to ask permission from the patient because sometimes they don't want to be referred. No? They want to keep it. So you have to ask permission if you will refer to other doctors, no? Or other symptoms or manifestations. No? Prescription. So you prescribe the patient, you tell them how many doses you will take, the dosage, what kind of medicine, explain to them what is this medicine for. So that is the ending of the interview. Of course, compliance. So after the patient, when the patient comes back, so you have to ask whether the patient was taking the medicine, and then thank you for coming again, no, for our follow-up, no. This is how uh, the program of treatment, no, how long, so you have to explain to the patient. Sometimes the patient will ask you, "O, doktora, pwede, usala kasi mana tapagbalik, no? Uda kasi mana, no?" So this is different. You have to explain to them that it's different from a cough problem, no? Because cough problem may be just simple, so pneumonia, the patient will just take the medicine for 1 week, no? And then because you are just hitting the organism inside the patient. So 1 week time, the organism will die. But here it's different. It's you may tell them that this is for to strengthen your feelings, so they will not be coming back. You're already okay, but we will have to in order that it will not come back, because in a day many times you have so many baggages in our life, so it's very important that this is your protection, that is compliance, no? You have to tell them why they keep on taking the medicine for a long time. The patients, especially schizophrenia, that is a lifetime medication. So do not let the patient tell when you are not doing it, no? Tell the truth that you are taking this one for a long time, no? Maybe I will just tell you when to stop, no? So here, and this is a private already. When you are in private, you have to tell the patient how much you are going to charge your patient per hour, because usually in psychiatry is per hour, or it's when there is a group family counseling. So you have to tell them why you have to pay this amount. It's not a matter of just paying, no? You have to explain, no? Or if they have insurance and you are already also accredited with that insurance, so you have also to tell them, no? So another is confidentiality. So you have also to tell them that do not worry, no? These are other factors that you have to tell them, of course, no? If you have a court order, maybe I will go to court, no, for you. So it would be better that you have to answer me very well. And then you have to also to ask if they have an intention to harm others, no? So those are the things, no? Confidentiality. So supervision. Sometimes the patient will ask you, why are you here? Why? I have a doctor. She is there. She is inside. So you have to tell, especially if you're already a resident. And then the missed appointment. So you have to tell the patient that if you will have a missed appointment, of course, their medication is not being completed. So you have to tell that it is good that you have to come when you are being told of your schedule to come, no? So your session is 20 minutes. You have to explain the 30 minutes. So that is how you charge your fees, no? So for psychotic patient, it may be 10 minutes. If it's grossly psychotic, you may not interview patient. You'd rather observe the patient, because you might be boxed, you might be anything, they will harm you. Availability of the doctors. So sometimes you are not available during the next appointment, so you have to tell that maybe other doctors will see you. You will be covered by another doctor, as a psychiatrist. You have to tell them in advance, because they will again adjust, diba? Even you. If you will go to a doctor and then when you come back, she is not the doctor anymore that you saw before, no? So how much more the patient that they do not have trust, no? So sometimes the patient will come, doctor, ay na to nag-interview ako nun una, where are they? So you have to tell them that we are here only for 2 weeks, you will be moving to another area or to another department, no? So you have to tell that, no, illness of the doctor, no. So the doctor that you refer is ill. So you have to tell them maybe she was not around because it's because these are patients. The patients you really have to explain to the patient. Diba? So the concept on ideal interview, you have your, as I said, you have establishing your rapport. You have the mental status. Later we'll take up what is mental status. Then the specific techniques I've already explained to you. Then diagnosing the patient so that you can give the proper medication. That is the dimensions of an ideal interview. In general, an interview must convey an attitude that is non-judgmental, interested, concerned, and kind. So when you face your patient, it's not just a matter of, kay psychiatry man lang ini, I mean, it's election man naman. You have to show to the patient that you are interested because they can feel that, so why should I tell my doctors because they are not interested what I'm talking to them. So non-judgmental. So when the patient comes, especially those who are working in what you call that, entertainer. So I mean, ato kayo na trabaho. Ay kana trabaho ako where they work in Japan. Ano ka dito, dancer? Dancer ka ngayon. So do not do that. No, non-judgmental. No. Concerned, you always be concerned with your patient, kind but not have empathy on so much empathy, no? So you're to be kind, so I feel sorry that you had those experiences, so you tell your patient. Not that, I will give you, sige ba kay para sa iyari kay pagbabalik-balikong ka, kay naluoy ka, kay you do not, the patient has no money and she will be coming back again and again to ask money for their fare. Because you are kind. No, it's not. That's different. Patient, when you are so kind, because they have no money, they will be asking you till the end, wherever, what department you go, they will be following you. No? So that is very important. No? So we will end that. So we'll just continue in another time next week again.
Thank you, Doc.
Yeah, okay. Bye-bye.